and also most likely to counter it. Um, you're seeing a notification now that we're going to record this meeting, um, because some members of the public and some members of the press were not able to be here, but they asked for a recording. Um, we also realized, I want to point out during our check-in this morning, that we're having trouble activating the closed captioning and we weren't able to fix it before the meeting. Someone is still trying to work on that right now. Um, and I'm really sorry about that. It's not okay. When we post this meeting, if we're able to, we'll try and add captions to the posted recording. And at worst, we'll make sure that we include a transcript. Again, I'm really, really, really sorry about this. As we go through this virtual protest, we want to remind you to submit your public comments to HICPAC at hicpac@cdc.gov before November 6th. We hope that some of the speakers today can provide you with some inspiration or some language that you might use to craft your own personal comment. So feel free to take notes, start writing your comments as we go, and use this time to sort of start being active in this fight, if you haven't already been. I know a lot of people in this room are already like knees deep in this battle. And speaking of those people, I want to thank everybody who came together to put this event into motion. We've got people from the People CDC. I'm getting messages that my internet stable is yucky. Can you guys hear my audio okay? Okay, thanks. We've got people from People CDC, COVID Safe Maryland, shout out Massachusetts for Health Equity, just to name a few of the organizations that helped us sort of coordinate this. We also would not be in a space, we can't be in the space that's critical of HICPAC without uplifting the work of National Nurses United, who have been really leading the charge on making healthcare spaces safer for all of us. So let's hear it for NNU and everyone who helped make this protest happen today. Okay. Let's talk about the HICPAC meeting. We've demanded that they show the public the guidelines that they're asking us to comment on. These guidelines were kept secret until this very morning. So 20 pages of draft recommendations were posted mere hours before the meeting started. And in our cursory look through them, the draft looks exactly the same as the previous one. Not a single adjustment has been made based on the voices of healthcare workers, patients, or the public, or other key experts who have been expressing concern about these guidelines for months now. We've also asked them to open this meeting up to public feedback, to occupational health and safety professionals, to aerosol experts, to disability and patient groups, to people who know what they're talking about and who are not compromised, to the public. Instead, they're streaming a closed meeting on YouTube. Boo! So just to back up a bit, give a bit of history, the progression of access to these meetings has moved in the wrong direction. In June, the meeting was broadcast on a Zoom. The question and answer period was open, so we could ask questions publicly, and everyone present was allowed 3 minutes to make a comment. In August, the meeting was broadcast on Zoom again, and again, we could ask questions during the Q&A. That doesn't mean these were satisfactorily answered, but we were able to ask them. And only 14 people were allowed to make comment. And this time we can watch the meeting on YouTube with no Q&A at all. And if we were not selected to be somebody who could make an oral public comment, there is no other way of participating in the meeting at all. Boo! They told us this meeting was virtual. It turns out it's not. I don't know who's tuned in at all this morning, but they're there in a place together meeting. So the committee members are all in person. Everyone else has been asked to join virtually. There was nothing published about the meeting location or a way for the public to join in person if they wished. This turns out to be not the correct process for hosting a hybrid meeting. But it's very clear that they're trying to do this in the dark, right? They think they can hide as they do the bidding of hospital CEOs and of shareholders and of industry. They think they will make dangerous changes to protocols and nobody's going to see or nobody's going to object. And they think that we will watch this meeting quietly in our homes on YouTube. And they are wrong. We see you, HICPAC, and we object.
I don't mean to interject, Zoe. I'm going to mute everyone.
Oh, sorry. Don't. Yeah, no, don't.
Yeah.
Don't. Go ahead. What were you saying, Sam?
Oh, no, that's it. I needed to mute all of the non-speakers.
Okay. That's all. Okay, great. So I'm going to pass it over to Nia.
Thank you, Zoe. 3 years into the pandemic, as we're starting to see some of the very real effects of not just acute COVID infection, but also the plethora of conditions that combine to make up long COVID, it should be the job of the CDC's HICPAC committee to act in a way that is responsive to this research and to act in a way that is responsive to the needs of the millions of Americans who are experiencing these conditions and the millions of Americans caretaking those who experience long COVID and other chronic health conditions. It should be their job to concentrate their efforts on protecting the population from further illness, death, and disability, especially in hospital settings. Unfortunately, this has not been the case. They have prioritized short-term profit via means of deception over transparency and public health and safety. So we're here today to speak up, to write comments, and to hear from others on the stakes of making ourselves heard from now until November 6th, to tell HICPAC that we are affected and that we demand the use of N95 respirators, sufficient ventilation, rapid molecular testing, and isolation in all healthcare settings. So I'd like to introduce our speakers for today. Our first speaker is Jennifer Ritz-Sullivan, who is a disability advocate and member of Massachusetts Coalition for Health Equity. I would like to welcome Jennifer to unmute. Are you here, Jennifer? Maybe we'll move to our second speaker for now. Our second speaker is Pantea Javidan, who is needs to be unmuted. She's here. Sam, can we unmute Jennifer Ritz-Sullivan?
I don't. Is it Jen?
Thank you. I apologize for that. It's the mute feature is still on. So yeah, hello. My name is Jennifer Ritz-Sullivan. I'm disabled, chronically ill, and COVID bereaved. I lost my 66-year-old disabled mom, Earl Dawn, to COVID. She was one of 77,000 people that we know of to die of COVID in December of 2020 in the US alone. My mom contracted the virus from a household member who did not wear a mask. Her death was preventable. My mom and the millions of others who have died from COVID have been treated as disposable and inconvenient statistics. My husband works a high exposure job and is frequently the only one masking with a respirator. We caught COVID for the first time this spring through my husband's job when cases were considered relatively low. Despite being up to date on vaccines and having access to Paxlovid and numerous over-the-counter medications, it is the sickest I have ever been, and I haven't fully recovered. I am now further disabled by long COVID, which is debilitating, because one-way masking isn't enough to ensure safety from aerosol transmissible viruses. I didn't consent to COVID, and neither did my mother. Although there are some medical needs I am currently able to put off until it's safer, I still require frequent office visits. My healthcare center dropped masking in May, shortly after I contracted COVID, stating, "We hope we can continue to support and respect one another and allow each person to navigate their personal safety as they deem appropriate." I remain at high risk for the same disease that killed my mom and further disabled me. My safety depends on others taking precautions, including masking in an N95 or better. I requested that my providers wear respirators when meeting with me, even offering to supply them. And I was told that staff only need to wear surgical masks if asked by a patient, as they go by CDC guidelines. Where is the support for my safety? Surgical masks worn by a few providers in a large healthcare facility are insufficient to protect anyone from aerosol transmissible diseases. Every medical visit requires prompting, advocacy, and risk, which depletes me. And with my masking at the top of my file, I still have to state the request when I book my appointment, when I arrive for it, and when I meet my physician's assistant. I've had providers become rude to me the second I ask them to mask, huffing, rolling their eyes, and one wearing a surgical mask under their nose the entire time, as if they've never worn a mask before. We need increased universal guidelines in healthcare settings for the safety of everyone. No one should have to risk disability or death to receive medical care. And we must learn from the dead and the disabled, and we must do better. Thank you.
Thank you so much, Jennifer. Our second speaker is Pantea Javidan, JD and PhD, who is a Stanford University faculty member who researches inequities of pandemic policy. I would like to welcome Pantea to unmute.
Thank you. I will restate what I stated to HICPAC recently. Good morning, Pacific time. I'm Dr. Javidan, faculty at Stanford University, speaking on behalf of myself as an academic who researches the inequities of pandemic policy and who's deeply concerned for loved ones suffering from long COVID or who've been diagnosed with chronic conditions such as cancer during the pandemic, including oral cancers for which they're unable to mask themselves during examinations and treatments. I come before you today to stress the vital importance of ensuring that the updated guidelines being considered fully reflect a solidly scientific understanding of aerosol transmission, especially as confirmed during the COVID-19 pandemic, and that they are crafted to fully protect against infectious aerosols. Please take seriously the hundreds of experts in the most relevant fields who have written a well-informed warning against the plan to weaken guidance for healthcare respiratory protection and infection control. Nosocomial COVID has proven deadlier and more dangerous than community-acquired COVID, with a 10% mortality rate, according to the most recent and reliable reports. When healthcare settings are infecting patients, while COVID continues to be the third leading cause of death, it deters many from seeking healthcare. As someone who insists on high standards of methodology from myself, peers, and students, it is alarming that the CDC and HICPAC process lacks essential input from crucial stakeholders, lacks transparency and public engagement, and encourages minimal standards of protection, which is deeply troubling in light of nosocomial COVID. Experts are urging HICPAC and CDC to open the process for public access, and insist on a clear, protective approach, recognizing the science of aerosol transmission, including inhalation protection. The existing review on N95 respirator versus surgical mask effectiveness is flawed and requires reevaluation with expert guidance. Failure to acknowledge vital control measures like N95 respirators, ventilation, and air filtration for controlling exposure to infectious aerosols must be corrected. Rather than regressing backward and erasing pandemic lessons, please maintain and strengthen protocols for prevention and control of aerosolized pathogens in light of SARS-CoV-2. Please center the most vulnerable and understand the unequal and unfair power dynamics of an oral cancer patient having to repeatedly request healthcare personnel to wear an N95 every time they enter the room. As the American College of Physicians just declared, health is a human right. Thank you.
Thank you so much, Pintea. Our third speaker, Jennifer Kunze from COVID Safe Maryland, will be sharing the story of another member of that group. I would like to welcome Jennifer to unmute.
Yes, thank you so much. Like Nia said, my name is Jennifer Kunze, and I'm a part of COVID Safe Maryland. I've also been dealing with long COVID for more than 3 years now at this point. And HICPAC needs to make actually protective guidelines that will strengthen infection control standards, not undermine them. We already know that inadequate infection control in healthcare settings is harming people. This is not theoretical, it's already happening. This past summer, another member of COVID Safe Maryland had to take their partner to a top teaching hospital for an arterial dissection with a pseudoaneurysm. Their partner caught COVID-19 in the hospital, where many of the staff were unmasked, including even the ICU staff. Our member caught COVID-19 afterwards while caring for their partner. After their partner was discharged, they both had to go home to work on their partner's recovery from the arterial event, as well as at the same time recovering from both having had COVID-19. This arterial event left their partner at a high risk of stroke, and they're rightly concerned that COVID-19 will make him even more vulnerable to a stroke. Meanwhile, our member, who was already disabled with long COVID, has not recovered to their previous baseline after this reinfection. We need to be able to get healthcare without getting sicker. But without strong infection control guidelines, people will get sick while accessing healthcare. Some of us will not recover, and some of us will die. Those are the really real stakes of this decision, and we need HICPAC to do better.
Thank you so much, Jennifer, and to the COVID Safe Maryland member for that testimony. Our fourth speaker is Theodore Pack, MD, infectious disease physician and researcher. I would like to welcome Theodore to unmute.
Hi, everybody. My name is Ted Pack, and I'm an infectious diseases fellow in Boston. At this point, I have probably seen hundreds of COVID patients during this pandemic, and I continue to be just shocked and troubled and just completely disappointed by how many cases of preventable suffering, death, and disability we have seen this pandemic contribute to. And in too many of those cases, in my opinion, the healthcare system itself has borne some responsibility for harms that occurred. I have had colleagues, other healthcare workers who have become sick with COVID, some of whom became disabled, seriously injured from it, and the sort of ignorance of how this is a problem in the healthcare setting is a very difficult thing for us to deal with at this point of the pandemic. I feel like during COVID, we had learned so much. We learned so many lessons. There was so much science that was done to increase our knowledge about how respiratory pathogens transmit in an airborne manner, and how masks and particularly N95 respirators are very effective at preventing that. We use these tools throughout the pandemic in healthcare settings, in many cases, to protect ourselves. And it feels like now a lot of these lessons are being slowly ignored um, or de-emphasized. I too agree with the what others have said on this call, that the review of evidence that I see here in these draft guidelines for the so-called conclusion that N95s and masks are equivalent for preventing spread of these pathogens is insufficient. Just on a cursory review of it, a lot of it is from the pre-COVID era. I'm concerned that the increasing use of the word endemic for COVID itself will now cause the same logic to be applied to COVID, which I think is completely inappropriate, given how different this evidence is in the CDC's review from everything we've learned about COVID since the pandemic happened. Nosocomial COVID causes substantial death and disability. I've studied it and released some opinion articles about it, as well as some research myself. It's inadequately studied in the United States. It almost feels like we have neglected to collect data about it here, due to both our problems in our public health infrastructure, but also just a lack of willingness from regulatory agencies to want to engage with that data and really understand the problem. I also believe we should not be putting the burden on patients to become their own infection prevention experts every time they go to the hospital. I think that's unethical. I think that's an incredible change in what I thought our responsibilities are as healthcare providers. It is disturbing to me that so many leaders in this field talk like that now, that every time somebody comes to the hospital, usually in their greatest, in a moment of needing help, or often not being able to advocate for themselves because they're sick, that we're going to expect that they enforce infection control rules. And I'm very troubled just to hear all the stories about that from my own patients and the people on this call. And I'm hopeful that at the very least, by making a lot of noise about this, that we can continue to change minds. There's a lot of incentives, unfortunately, in the system to reframe this problem, I guess. But I think it's unacceptable that we neglect the important needs of our patients to protect themselves in healthcare settings and healthcare workers from this infection. Not only COVID, but really all respiratory viruses, which this is definitely not the time that we should be decreasing our protections against these pathogens in healthcare setting. Thank you all for letting me speak here today.
Thank you so much, Theodore. Our fifth speaker is Noelle Sanders, who's Senior Community Organizer at BCIL. Noelle, please feel free to unmute.
Thank you so much. Hi, everyone. Hopefully you can hear me. I have a fan going in the background. Is my audio okay? Awesome, great. Thank you so much for hosting this event and for having me. I just want to kind of obscure details for consumer confidentiality, but I really want to highlight just the danger of the narrative that people don't want masks, that the American public especially is like over masks, done. I feel like number one, any trip on the MBTA, for example, you see about half the cars are masked, half not. I think that really definitely demonstrates the fact that people are concerned about their health and are just suffering from mixed messaging. People want to do the right thing, but they're getting conflicting messages about how much and how they need to protect their health. But especially within the disability community, I work at BCIL, the Boston Center for Independent Living, and we support consumers with all kinds of disabilities, whether that's physical, visible, if you will, or invisible. And we don't require proof of or documentation of disabilities in order to serve people. We see a lot of people who are going through the struggle of wanting to use their ADA rights, having reasonable accommodations in medical appointments, asking their providers to mask as those accommodations, they're encountering a lot of pushback and kind of having to do what speakers were saying before, having to be their own experts in epidemiology and protection, having to argue with healthcare providers just to access safe appointments, which if you're living with disabilities, you need regular, often in-person appointments for just maintenance of your health. And patients, consumers are being asked to choose if they're going to go without long-term maintenance health or risk potentially life-altering complications or ultimately death just in order to get healthcare. And a lot of the system is putting this misinformation is putting providers and consumers at odds, even though it's a struggle that we're all engaging in to pursue our health together. So just a couple of examples. Several consumers have come into me, mostly parents especially, who are worried about their kids who have respiratory chronic illnesses, a lot of them having to do with lung capacity, and their kids are in schools, their kids are masking themselves, but they're worried about asking educators, even classmates in the area to mask, even healthcare providers within schools that they see in between classes for health, because they're worried about retribution on them and ultimately on their kid being seen as unruly or already being in IEPs and being worried that asking for yet another accommodation request will be too much, will rock the boat. Ultimately, they don't want to sacrifice their kids' education and they're being asked to choose between their children's health and their children's education. And a lot of times, these consumers that come to me 3 times recently, these parents are people of color, a lot of them from immigrant backgrounds, who are also weaving into those concerns about their child's well-being, concerns about their citizenship, their residency status, and all of this impacting whether or not they feel empowered to advocate for their kids' health. Even though these things are technically completely within their rights, the question is, will their rights be respected? Will they be enforced? And so much of what we're seeing in healthcare centers for patients is that exact question. It is your right to mask. It is your right to ask a provider to mask, but will your requests be honored? Several times also, we'll see consumers who it's taken them so long to find empathetic providers who even are trained in how to work with patients with disabilities, and especially with patients with physical disabilities. It can take a lot to find a provider who is able to work with what's often a long list of accommodations requests you need. And patients find themselves worried about jeopardizing long-standing relationships with their providers because they know their providers have been hesitant to mask. Their providers kind of have that reaction of saying it's over, it's unnecessary, any danger you'll incur from getting COVID is relatively low. And they're being faced with the question of, if this is the only specialist who even treats me as human that I've been able to find that my healthcare covers that's near me, should I put that relationship at risk because my provider is resistant to masking? It seems like such a small thing, but it's at the same time such a critical thing in the question of survival of health, of life and death. And it comes back to that concept of putting the health and safety of a patient, that burden, on the patient alone solely, and not in these institutions, these healthcare centers that are meant to be just as big, if not bigger, advocates and protectors of our health and well-being as residents, especially in Massachusetts. So just kind of highlighting that, I think, is really important. It all comes down to that question of the information that people are getting. A lot of people are genuinely confused if masking is needed, if it's enough to be vaccinated. And so many people would wear masks if it was communicated very clearly that this is a simple but highly important and critical step you need to take, just as strongly as we push the vaccination method. It's kind of like driving. You should wear a seatbelt, but you also have airbags. We need all of these methods of protection, and we should be emphasizing all of them, especially masking, since single-way masking, one-way masking is significantly less effective than two-way masking, and at large, having everyone in an institution or as many people as possible masked as well, with quality masks, not just surgical masks, of course, also emphasizing the importance and the difference between masks and the importance of quality N95s, not just KN95s or surgical masks, with obviously respirators being the gold standard. Feel free to reach out to me if you want, any more details. Like I said, I'm trying to be a little bit vague to protect the details of consumers. But we're seeing just a general growing trend of people who want to protect themselves and are worried about institutional and individual pushback as a result of just asking for something as simple as wearing a mask. Thank you so much.
Thank you so much, Noelle. Thank you everyone for being here and for speaking. We'd like to spend the remaining 20 minutes maybe taking a couple of comments from other attendees who would like to speak on the importance of implementing proper infection control in healthcare settings. And at the same time, we'd like to encourage you to start writing your HICPAC comments while on this call. So as a reminder, the email for the comments is HICPAC, HICPAC at cdc.gov. And send text messages to your friends, colleagues, and relatives to get their comments in as well. I can post a sample letter in the chat now, and maybe Salem, do you want to see if people are raising their hands if they would like to comment?
Yeah, so if you would like to give comment, please raise your hand so that we can unmute you.
Hi. I just got unmuted, so I hope everyone can hear me. My name is Nina. I live in Brooklyn. I'm a practical nurse. I actually work in care coordination, which is quite unique. I used to work in a facility setting, and I've worked in home care. I've worked in so many different kinds of settings. Really the trenches, because that's where LPNs work. We work on the front line, the frontest of them. Anyway, I really love the work that NNU is doing to advocate for safety in the workplace, because I do think that this is where it starts. A lot of LPNs cannot work in hospital settings. We work on the fringes of the hospital. So in community-based care is what we do. And a lot of the time, in my experience, it's been that we don't have a lot of support by our institutions and our organizations to mask or to protect ourselves. I remember when I worked in home care, I got COVID and I was expected to return, and I worked with a pediatric population in their home. And that was the expectation, that was the standard, and that was during the height of the pandemic, the height of it, what they considered the emergency. I'm quite excited talking about this because it's very refreshing. I had tears in my eyes when I was listening to your testimonials, because I just feel like, we need to talk about this. We need to talk about workplace conditions. We need to team up as healthcare professionals. And yeah, that's all I wanted to say. So thank you for letting me rant, and I really appreciate this meeting.
Thank you so much for speaking. All right, I will unmute Emmett Patterson, I believe, was next.
Yes. Hi, everyone. My name is Emmett Patterson. You've seen him. I'm a white bisexual trans man coming from Philadelphia. And I really just wanted to speak today because I often talk about, living life as a trans person coming out more than a decade ago. I often had to be the person teaching my providers very basic care for my body, especially as a trans man who had sex with all sorts of different people. And that's actually what got me really into the HIV movement and doing activism, as well as working professionally in HIV spaces. And I just want to comment that, it is so demoralizing to have now transitioned into disability right before COVID really hit the US. And I've never lived in a world as somebody who is medically vulnerable, immune compromised. And it just feels so excruciating to have to rely on the lessons that I learned having to advocate for myself, including still around, trans affirming care, other types of sex specific care. And I just wanted to basically say I am exhausted. I am tired. I have so little distrust or respect for many people in the medical profession. I come from a family of medical providers. My mom is an ER nurse. She's been working for over 40 years. My dad's a paramedic working for almost 50 years. And I just am so done, both personally, and I'm upset for them having to continue to go through the rigor of wearing a mask and being questioned by their superiors, by their colleagues, and by patients. So yeah, I appreciate you letting me comment, and I just want to reiterate that it is exhausting, and if you are feeling exhausted too, know that there are other folks out here who have been feeling this for a long time as well. So thank you all so much.
Thank you so much, Emmett. You can put your hand down, it'll be a little less confusing for me to pick on other folks. I believe we still have time left for the next two people who have their hands raised, and then I believe that will be about it. So next, I think would be Uriah Busey.
Hi everyone. Thank you for having me be here. I'm a little nervous to speak in front of everyone, but I'm honored to be in this space. I'm a Black, queer, trans, non-binary person from Philadelphia. I'm a visual artist, a death care worker who is also budding to have like official offerings that is paid. Been a death care worker since I was young. I'm 29 years old. I was already disabled before I've contracted COVID in 2021. I've survived it 3 times so far. And by the 3rd time, I contracted it in a dental facility at Temple University. And when I asked to be accommodated in a private room setting because of the shared air space, I was denied. It's taken me $3,500 to get adequate care, even with pushback, for a dental setting. I call places, I pretend to be a doctor to get the respect I deserve. It's disheartening. I've lost so much artist community. I've been pushing back, commenting. Things are like slowly happening in Philadelphia with mask required community art spaces. I've been so isolated, the loneliest I've ever felt. And yeah, I just want to be a part of change, and however small or large that is. I'm here in solidarity with the dead, with the living, the disabled, with people who keep going despite, and to hope that we have continued endurance. Yeah, I have a sister who's in housing, and she's in assisted facility for care. She's a nonverbal autistic person. I've been her care provider since I was young as well. And so the amount of advocacy I have to do for her and myself, I've had to do it for my housemate who went to top surgery, also at Temple University. I had to make sure all the doctors were wearing masks. They pushed back, and then it decided because I wasn't budding or moving. And it sucks because I see my friends getting tired. I see them like not wanting to engage in that resistance, and it's lonely. It is so lonely. But we have to do it. And yeah, I'm like stuck at like small crossroads of where do I go next? Like I want to go to grad school for art, but I also don't want an institution to kill me. So yeah, thank you for having me talk, and have a blessed day.
Thank you so much for sharing. And I think the last person we can have up is Eve Lorelei.
Hi,
Eve. Okay, there you
people hear me okay? Can people hear me okay?
Yep,
Oh,
you're
okay.
good.
I'm like shaking right now. I'll try to get through this the best I can. I'm Eve Lorelei. I'm a disability rights activist. I'm autistic. I have complex PTSD and OCD. Um, and it's been, despite a lot of really horrible things I've been through in my life, I think COVID safety negligence has caused me to be the angriest that I've ever been. And my sister as well, who is also a disability rights advocate uh, advocate, and she works with students and helps coordinate disability accommodations for them at universities. And we've both been the angriest that we've ever been, and have just felt like have felt the felt like many people who claim to be progressive and claim to be dedicated to human rights and equity um, have have had promises that have started to feel a lot more performative, and that a lot of um, it's it's been making us feel like a lot of um, progressive activism is empty promises and lies, um, and that um, the disability community has truly been abandoned and thrown under the bus, and it almost feels like genocide, um, in a way. And as someone else said, we're being treated like an inconvenient statistic. Um, and I, because of complex PTSD, um, because of me dealing with that through my whole life, I've been extremely isolated, even before the pandemic, and have just not had any trust in fellow human beings, and haven't been able to have any friends or meaningful relationships. And um, COVID and the negligence of COVID safety has made that even worse, mainly because of my distrust in people. Um, and I'm afraid to go to the hospital for any sort of medical care because um, of just I'm absolutely floored by the fact that people don't even wear even surgical masks in hospitals anymore. Um, and I, my sister, who is the other disability rights advocate in the family, she um, compared to the rest of my immediate family, she's like the sparkling picture of mental health. But I have been extremely worried about her in terms of her mental health, and I've never seen her um, in such a dark place before all this. Um, and that's all of that in a all of my feelings about that in a very, very small nutshell. And I'm grateful to be here, and thank you for
Eve.
listening.
Thank you, Eve. I just want you to know you're not alone. I too have PTSD, and it is very hard having to deal with both things. Thank you so much.
We'd like to thank everyone
Thank you as
for
well.
attending. And we'd like to encourage you and sorry, we'd like to encourage you, and we'd like to encourage you to encourage those around you to submit your comments before November 6th, and to let this meeting be a motivator for you, and to send it to others once it's finally posted. So thank you all so much.
Thank you for coming and joining us today. And we hope to see you in the Substack or in other places. We're hoping that maybe this was such a great turnout. Maybe we'll do more events like this, get people together for some co-working sessions, write your reps, write to, other public comments, things like that. And I think Sam, are you going to speak about saving the chat and stuff?
Yes. So I'm dropping in the chat right now a link to a Google document. The Google document contains key text and notes that might be helpful to you as you prepare a comment. It also includes a sample comment from the People's CDC. It includes instructions for how to get your comment to HICPAC and also how to share your comment with the People's CDC, which would be very helpful. And once this meeting concludes, I'm going to include the chat from this meeting at the bottom of this document as well, because a lot of really useful, thoughtful comments and resources were shared today from everyone that attended. Thank you.
Thank you all again. Oh, and thanks to Cass, who's been doing transcription in the fucking chat. Cass, thank you so much. We're so sorry about not having Cece, and we promise we're gonna do better next time. Thank you all so much.
I'm admitting a bunch of people who have just arrived. One moment, I'm gonna... So everyone who is just arriving, unfortunately, there was an issue with our account and the event was capped. I'm admitting you now so that you can see a document that we created as part of this event so that you'll be able to participate now that it's over. So if you look at the chat as you enter, you'll see a document where the People's CDC has collected a variety of resources that might be relevant to you as you prepare comments for HICPAC. It includes instructions for how to submit your comment to HICPAC. The deadline is November 6th at 11:59 p.m. It includes instructions for how to share your comment with the People's CDC, and it also includes a transcript of the chat for this event, where people had a lot of thoughtful ideas and resources to share. The recording of the webinar will also be made available. I'm not sure where or in what forum, but we can attach a link to it to the bottom of this document that I am sharing in chat. All right, everyone. I'm the person with the power to end this event, so that's what I'm about to do. I'm going to put one more time in the, oh, I see a person coming now. So apologies to the person I've just admitted. The event was capped, unfortunately. There was a technical issue at the beginning. I allowed you in because I'm sharing in the chat a link to a Google document that includes the transcript for today's event. People had a lot of insightful comments and useful resources to share. It also includes links and quotations from material that might help you as you create a comment for HICPAC. It includes instructions for how to submit your comment to HICPAC and instructions for how to share your comment with the People's CDC. I'm going to paste it in one more time, see if anyone else wants to say a parting word, and then I will end the event.
Thank you, everybody, for coming. We are not alone.